Hey guys, Oscar here with Gastroenterology Simplified. My name is Oscar. I'm a board-certified physician assistant, and I'm here to educate you and make gastroenterology simplified. And I'm here to help you if I can. Well, this week, the diagnosis of gastric ulcers have been somewhat common in the hospital. And what is gastric ulcers? What are gastric ulcers? Gastric ulcers are when there is a break in the mucosa of the stomach or the duodenum, which is the beginning of the small intestine. What are the risk factors? Risk factors are caffeinated drink, spicy foods, alcohol intake, smoking, the intake of NSAIDs such as Aleve, ibuprofen, bisagraph powders, just to mention a few medications. So how do you diagnose gastric ulcers? Well, you usually diagnose it with an endoscopy, a scope that goes down your mouth, through your throat, to your stomach, and we take random biopsies to make sure that you don't have H. pylori. H. pylori is a bacterial infection of the stomach, and the way to fix it is giving you antibiotics and so on. So let's just say, here's my issue here. I want you to hear me out. Here's my issue. Let's say you were diagnosed with a gastric ulcer, and you stop the medications and you change your eating habits and so on, and you're not taking any NSAIDs or anything like that. And the pathology report came back negative for H. pylori. So when you were discharged from the hospital, or after you were discharged from the endoscopy suite, usually you will get a prescription for protonics such as or omeprazole, pantoprazole, something to lower the acidity of your stomach, therefore to promote healing of the stomach. All right? Now, I want you to hear me out on the key factors here. Let's say the gastric ulcer was significant, so let's say 6 to 8 weeks from the last endoscopic procedure, you have a repeat upper endoscopy to assess healing of the gastric ulcer. Let's just say the gastric ulcer is still there and maybe worsening instead of improving. So what could be going on here? And this is the main issue that I see very, very often. Yes, individuals change their eating habits. They stop the Aleve, ibuprofen, bisagraph powders, or any other NSAIDs or any other medication that could be contributing to the gastric ulcer. They stop the alcohol. But smoking is a key factor. Smoking will not let you heal that gastric ulcer. And that is something that I see so often. Individuals may make some changes. Most of them not 100%. Some of them make 80% change, 70% changes. But the issue here is that smoking also is a factor. And most individuals don't understand that. So what is the message here? What is the conclusion here? The message is that yes, in addition to changing your eating habits, stopping the offending medications, taking your acid-reducing medication, and stopping alcohol as well as smoking will help you tremendously on healing that gastric ulcer. So the message here is you have to stop all of the offending agents and yes, smoking. And just to close this video, I also want to mention that the gastric ulcers could have complications. If they don't heal, you could have complications from it, such as a gastric perforation, such as an ulcer that perforated. It could give you peritonitis, which is infection in your abdominal cavity, and it is dangerous. A perforation is very dangerous. So you have to keep in mind that you have to stop all of the offending agents, yes, including smoking, and also smoking THC is an issue as well. So you have to stop the nonsense, because at the end of the day, we're here to help you. As a medical provider, we are here to help you. We are here to help you heal with a little bit of medication, because likely you will need only a little bit of medication, because 80% of it is the lifestyle, offending agents, and so on. Guys, if you found this video helpful, please click like, subscribe so I can bring you more videos like this. And remember, I'm a board-certified physician assistant, but I'm not your physician assistant. Guys, stay healthy, and I'll see you in the next one.